Krishnan, because my journey in AK Pharmacy started with trauma, and now it's blissful because of them. They have been so helpful to me through my journey here, extending to PhD, and I cannot thank anyone else for this mission. Thank you. Now I shall talk about kidney failure. Mr. Pachamuthu, he has had a miraculous recovery and is full of love, joy, happiness, peace at the moment. So, you just print it. Now, Mr. Vasant says that I should talk with the PowerPoint because there are points there. Okay, what is kidney failure? It is the inability of the kidney to filter toxic and waste products from the human body. Anyone with kidney failure will have to face problems because the waste products are not removed. So what will happen? Normally, the glomerular filtration rate in the kidney decreases, creatinine increases, and there will be electrolyte imbalance and other complications as a result of these toxic waste products. Now, next slide, please. Now, creatinine. This is the waste product that increases in the blood when filtration of the kidney is not there. Creatinine is produced from creatine, which is from the muscle metabolism. And when this increases in the blood, it is an indication that the kidney is going into failure. Initially, there aren't many symptoms because kidney is very quiet with its problems. When it becomes totally unable to filter, that's when all the signs and symptoms will be evident. So it's good for people to do blood screening at least every 6 months so that we know that our internal environment, our blood, etc. are in a healthy state. Kidney failure is divided into two categories: acute kidney failure and chronic kidney failure. I am going to talk on chronic kidney failure. Now, in chronic kidney failure, mostly they have permanent kidney damage. So can you imagine an environment inside your body when the filtering system is not working at all? First and foremost, blood urea, blood creatine, and all the toxic products will increase in your blood. What will have this effect? It means that there will be an electrolyte imbalance. There will be acidity, increase in the acid levels. There will be irritation, nausea, vomiting, feeling of unwell. There will be psychosis as well because of increased urea and creatine in the blood. They will get some form of psychosis, depression, suicidal tendencies. Anyway, the fear of kidney damage itself will break a human being because they know there's no recovery from it. But medical science has come out with hemodialysis, where they wash your toxic products for you through mechanical means. There is 5 stages in chronic renal failure, as it is there on the screen. Now, first, kidney damage is there, but there's normal glomerular filtration rate. Glomerular filtration rate is actually the blood supply that goes into the kidneys. If there's not enough oxygen, the kidney will get damaged, including with all kinds of drugs, dyes, x-rays. All these are the poisonous stuff that damages the kidney tubules, the filtering mechanism, and the blood supply. So, when the glomerular filtration is mildly decreased, you can see the classification or the stages in kidney failure, chronic kidney failure. Stage 1, the kidney is damaged, but the glomerular filtration rate initially increases. So the glomerular filtration rate is 90 plus or minus. The second stage, the kidney is already damaged, but there's a slight decrease in the glomerular filtration rate. So that GFR, glomerular filtration rate, is about 60 to 89. Stage 3, the kidney damage is there, but the glomerular filtration rate is moderately decreased, 30 to 59 GFR. Now, when the kidney is damaged and the severe depletion of glomerular filtration rate, then the GFR is 15 to 29. Say the whole thing is damaged, the glomerular filtration rate plus the kidneys, you get plus or minus 15. And that's when they go for dialysis to save the patient's life and discomfort. What are the causes of chronic renal failure? Of course, the famous diabetes, hypertension, kidneys, some people are born with stones in their kidney or cysts in their kidney. Eventually, the kidney will be damaged by them. Now, drugs. For any pain, they just pop Panadols, Constans, period pain, Panadols, painkillers. You go to a doctor, you say backache, we give you the non-steroidal anti-inflammatory drugs. All this in a long run will cause damages to the tubules of the kidney, giving rise to chronic renal failure. Now, imagine a human being filled with toxins. So, what would you think will happen to him? Because the filtration is all not available because of the kidney damage, the person will swell up with edema all over the body, including the eyes and the legs initially. You'll find fluid everywhere, under the skin, in the muscles, in the pericardium, in the lungs. They can't breathe. They'll have chest pains. They will start vomiting. They will be itchy. The skin will start itching. And they will feel bloated. In fact, they'll feel miserable. Now, how do we find out whether this patient is having renal failure? The best result is blood tests, where we find the urea and the creatinine will be very high. Then, of course, we have scans, imaging, we have biopsies, chest x-rays, bone x-rays. Now, what happens to the bones when you are in renal failure? It seems to fracture easily and the healing is delayed. The parathyroid hormones are, under stress. The calcium is not absorbed and filtered properly, so you will have all these problems. Now, medical treatment is standard. What we will do is we'll try to flush out all the water. We use diuretics. Blood pressure will be sky high. We will try ACE inhibitors, angiotensin II receptor blockers, calcium channel blockers. We try to dilate the vessels, vasodilators, and renin inhibitors. But due to this chronic renal failure, the patient will develop anemia. Why? The kidney is the one that secretes a hormone called erythropoietic factor, which helps in RBC formation, and because of the damage, they'll have anemia. So we give supplements of erythropoietin factor as injections to maintain this imbalance and anemia. Electrolyte imbalances, we treat accordingly. Next. I would like to talk about Mr. Pachamuthu now. I don't know where he is at the moment. Mr. Pachamuthu was born in 1964. He was quite an athletic man, At the age of 21, 2005, even though he was a diabetic, he was a football player. In 2000, when he was playing football, he went into coma for 10 days in 2006 because football came quite strongly and landed in his abdomen. Other than that, he didn't have any other history on damage, what could have caused the damage to the kidneys. Now, if you see Pachamuthu now, he's a very happy, flamboyant, good, jovial, hardworking man. Look at him now, the way he's walking so briskly after 5 years of kidney damage. He's very hardworking, he's a good father, he's a good husband. Now his only aim is to make his family happy, get his children educated, and live a good life. But the journey that he had gone through this road of recovery, I would compare it to a pearl in the depth of a troubled sea. He just merged out of it successfully, as you can see him now. He has gone through a lot of trials and tribulations during this time. Finance is a big problem when you're very sick, because you're so sick, you need help from the hospital, and private hospitals are very expensive, but they're very quick in treating. So in the end, he had to sell all his house to survive. Well, finally, when he met Dr. Anandakrishnan, miracles take place. Dr. Anandakrishnan is filled with symphony, all kinds of music concerning people's lives, touches them, revives them, changes them to what we see Mr. Pachamuthu now. The capsules that AK has produced has got such a powerful stimulant in the body. Most of the time we don't know how it works, but it works through our research we have seen, because of the biochemical substances or products that seems to revive the body, restore, heal, and progress with dignity in their lives. Let Mr. Pachamuthu tell you something about Professor's medicine, how he felt after taking that medicine. Now, nowadays, from 2011, no one tests his creatinine level because he's stable. And his diabetes has healed, all because of Dr. AK's capsules. The micronutrients have so much of energy and power in healing that will be witnessed by Mr. Pachamuthu. Thank you.
Good morning, everyone. For 2 years, I was in the bed. I already told you yesterday that I was bedridden. First, I would like to thank a person for 5 years ago who come and concert in this place. Same place in Genting. That is Mr. Narayanan. He's my brother-in-law. He went and consulted with Professor regarding my failure. So Prof told him, bring the patient and bring the report. So I saw him, I brought the report. He told me I cannot cure your kidney, but I can give you confidence for your life, your healthiness, everything. First, I never believed. That's why yesterday I told you all laugh at me first, because first I saw the medicine, I was laughing to him.